Welcome everyone to the Nuance and Crescendo webinar today. Let's give it another minute for people to join and then we'll get started. So stay where you are and we'll get going imminently. Well, welcome everyone and many thanks for joining our webinar today, which is entitled Meet the GPs Saving 1 Hour a Day with Dragon Medical One. My name is Simon Wallace. I'm the CTIO for Nuance Communications, and I'm delighted to be co-hosting this webinar with our partner Crescendo, who will be giving us a demo later of Dragon Medical One. That's our AI-powered speech clinical recognition solution. It might be helpful just to say a few words about Dragon Medical One. In a nutshell, Dragon turns your workstation into a dictation station, so you can capture notes and create documentation directly into your EPR using your voice. The artificial intelligence makes it extremely accurate, and it copes very well with different accents. And there's no training of the speech engine anymore. You can use it straight out of the box, so to speak. The other feature is it's in the cloud, and this means that your single voice profile can be easily used in different rooms within your organization, different buildings, and of course at home. And that was very, very useful during the pandemic. Many clinicians have told us how Dragon has helped them save time and reduce their admin backlogs. But as you'll hear from our guest speaker shortly, there are a lot more benefits, even for the fastest of you touch typists out there. But more about that in a moment. Before we get going, just a little bit of housekeeping. If you do have any questions during the presentation, please type them in the Q&A box in your Zoom control panel. Please don't put them in the chat box, in the Q&A, thank you. And I'll be posing those towards the end. Well, with so much to cover, and without further ado, let me introduce our two expert panelists today and ask them just to say a few words about themselves. First of all, Dr. Barry Sullman, just a few words about yourself, sir.
Well, I'm a GP. I am a partner at a two-partner practice. We have 6,000 patients. There's never a quiet day. There's always exciting. Something's happening. And I also am a clinical lead for the CCG for prescribing.
Thank you very much, Barry. And our second speaker today is Simon Howard. Simon, a few words about yourself.
Sure, thanks very much, Simon. Yeah, my name is Simon Howard, and I'm a speech recognition and clinical documentation specialist consultant at Crescendo Systems. As the beard no doubt suggests, I've been involved in speech recognition for some time now, and in fact have been ever present throughout the evolution of Dragon technology since it first arrived back on these shores back in the mid-90s. As a consequence, I spent a sizable amount of my career actually at Nuance Communications, and more specifically Nuance Healthcare. And it's been a really exciting journey to watch this fledgling technology evolve into the powerful and fully featured Dragon that you will hopefully see in full flight today.
Yeah. So a seasoned campaigner, Simon? Thanks very much for joining us today.
Okay,
lovely.
Pleasure.
So let's get going, and I'm delighted to be able to spend our first 10 minutes by having what I call a fireside chat with Barry. I'm going to pose some questions to him and see what unravels. If you have any questions yourself, as I said, please put them in the Q&A box and I'll do my best to answer those at the end. This session is being recorded and will be available, and if we don't get to answer all the questions, we'll do that after the event. Well, Barry, let's start with this one, shall we? Can you describe how you use Dragon Medical One in your day-to-day clinical practice?
So I use it for my clinical work, and I also use it to record my learning within the appraisal toolkit. In terms of the clinical setting, I've used it in casualty, out of hours, extended hours hubs. I used it in 6 different consulting rooms in my health center, depending upon where I am in the health center. And this is sad, but I've got 3 workstations at home, and I've used it on all my 3. I've used it on all my 3 workstations. The beauty of this current iteration, and I must say, Simon, I'm very impressed. You've been doing Nuance for 30 years. I've been involved in this for about 20 years, and I would say that the beauty of the current iteration is that whatever enhancements I make on one workstation become immediately available to me and anywhere else I work. It's also faster. It's extremely accurate. There's no training. It's basically clean, fast software. When I used this in the various places, I thought casualty would be a difficult setting simply because of the sheer noise and total chaos. I mean, the place is almost, I would describe it like a cattle market, but Dragon performs perfectly. I've also managed to install it quietly without anybody noticing on the computers in casualty, even though I've got no administrator rights and I only use a temporary access card. So it's really easy to install. So I use it in all these clinical settings, and I use it to record my learning. And it's really useful when I'm recording my learning because I don't have to spend time typing. I just think, what am I learning? What are my reflections? And I just dictate my reflections.
Very good, very good. Well, it's very interesting what you say about casualty, and I'm sure Simon will talk about some of the noise cancelling properties of microphones and things, which is key. Your other point emphasizes that, of course, speech is now available in the cloud, and that allows you that flexibility, doesn't it, to be at different workstations and different institutions. Well, let's go on to the benefits. What are the key benefits that you've found using Dragon in your clinical workflow?
So when I use Dragon for the whole day, I can typically save an hour, and that's simply because it's faster to speak than it is to type. However, it's also important to point out that I'm a touch typist with a speed of about 60 words per minute at best. So for people who type slower, the time savings are going to be substantially greater. But although time saving is often spoke about, and in fact, that's the title of this webinar, in fact, in my opinion, that's one of the smaller benefits. There are some other benefits which are much more important from voice recognition. And if I can, Simon, I'd like to just go through them with you now.
Sure, yeah, please do, yeah.
We're sending a lot more messages to patients now through our online platforms, things such as text messages or emails. With voice recognition, it is possible to construct a much more detailed, robust, well-constructed and fully safety netted message simply because you've got more time to do it. With typing, you have less time to create those messages and you sort of get fatigued. With talking, you can just talk a huge message in just a few moments. This is really important because safety netting has to be documented. Otherwise, from a legal and legal point of view, it didn't happen. And I've been in a situation in a coroner's court when something was not documented and it was deemed by the coroner that it didn't happen. In fact, it did happen, but I hadn't documented it. So the documentation is really important. Right. Secondly, because these messages that we're sending to patients are now much more detailed, we're actually able to manage the patient using messaging rather than having to speak to them, which again saves time. All my colleagues on this call will know that once you phone a patient, the call can go on and on. But with messaging, it's much more quicker and you can create fully detailed, thorough messages with a lot of information in very quickly. In addition, when you dictate messages, you put in a lot of niceties, which under time pressure typing you can't do so easily. So for example, comments such as "good to hear from you," "I hope this is helpful, please do get in touch if you need any more help." Things like this are a lot more easier to put into the message because speaking is faster than typing. And as a result, messages that you create using voice recognition are not just polite and friendly, but they're also well signposted, robust, and have very clear safety netting.
Right, right. I mean, that's really interesting, isn't it? Because you think of using your voice and just speaking into the electronic patient record, but actually, your example of texts, it is a very, very becoming much more common form of communication with patients. That's a very interesting additional sort of piece of functionality. And the bit about the coroner's court, the importance as clinicians of documenting our pertinent negatives. Because it takes time, we often will skip it because it's not a positive, but your example in the coroner's court makes that point really, really important. Can I go on to what you feel from your experience is holding clinicians back from using speech recognition?
Well, clinicians are addicted to using the keyboard. I am addicted to using the keyboard. It's
Right.
so easy to type. And what I eventually had to do is I actually moved my keyboard away from me and put a microphone in the keyboard tray in place of the keyboard. And by doing this, I was forced to use the microphone rather than the keyboard. Now, here's a really amazing thing. What I discovered was that by forcing myself to use voice recognition, to my surprise, I could do everything by my voice. Moving the keyboard away also had another advantage. It also helped highlight the common things that I would do with my keyboard. So the really common actions that I do, I then actually program them into the microphone. So I've got one of these microphones which has got buttons on it, and you can program them. And I do all the common things with using my thumb on the microphone. And the combination of programmed buttons on the microphone and the voice meant it is actually not necessary to have a keyboard on the desk. Having said that, let me be honest, having said that, I do have a keyboard on my desk, but I keep it away from me. The idea is I'm trying to teach myself to stop my keyboard addiction. I'm trying to use my voice as much as possible, and it is possible to use it completely.
Right, right. I mean, I love that term. Clinicians are addicted to their keyboard, but that's the last thing they want, isn't it? But it's like we're forced to become addicted, not through. Well, that's, I guess, the definition of addiction. But it's a really nice way to highlight that. Let me go on, if I may. What's your experience of some of the more advanced Dragon features? And by that, I'm thinking of using voice commands or auto text templates. And if you wouldn't mind just explaining what you mean by a template and how you use that.
Well, the quality of consultations is improved by using auto text templates. For example, I've created for myself 3 different templates called baby, pediatric, and adult. So I just say pediatric template, and a complete examination consultation auto text is created. Now, that examination auto text is a ready-made structure forming a checklist. It ensures that when I do the pediatric examination, I do a complete examination and I haven't forgotten anything. Many times the child is left and I think, oh, did I check this or did I check that? And I can't remember. But having that checklist automatically created helps to make sure that I've covered everything. Furthermore, having a standardized consultation structure ensures that the consultation looks very smart, professional, and well done. It provides safety because everything has been covered, and it ensures a consistent high standard of consultation across the whole organization. It's a win-win for consultants and patients alike. It's for everybody wins out of it.
I mean, there's a theme coming through from your previous conversation about coroner's court, about the need for quality documentation. And the whole premise of that is not just good clinical care, of course, but also patient safety. So really interesting to hear that angle. Can I just ask you a hypothetical question, if I may? If we dare have the courage to turn Dragon off tomorrow, what would you do? How would you feel?
Well, sometimes when I have come into the office and I'm just rushing, sometimes I don't start it and I don't have it. And when that happens, I feel irritated. Using the keyboard has started to become a nuisance for me. Now that sounds crazy, but the keyboard has started to become a nuisance, a hindrance that holds me back. I like the freedom of speech. This may sound strange, but at times I feel like I'm talking to my computer, just like you see in Star Trek. And the reason for that is I've programmed in all the things that I do, all my auto texts, all my commands. It's become a servant of my voice. I mean, it's not quite like the Star Trek computer, but it's just does everything that I want it to do. And so when I wanted to open a particular type of auto text, when I'm copying and pasting from my online platform, it's become a servant of my voice. And when I don't have Dragon, it's like losing that servant. And absolutely, honestly, I feel irritated.
Right.
I feel irritated. I feel the keyboard is a hindrance and slows me down. And, I just say, I've got to get this, get started quickly because I can't use the keyboard. This is becoming a nuisance.
Okay. Well, look, this has been great, Barry. And we could go on chatting for another 20 or 30 minutes, but let me just finish off with one final question, if I may. If you had just one word to describe Dragon Medical One, what would that one word be?
It's easy. Safety. Absolutely
Okay.
safety. This
Okay.
software allows me to put all my thoughts down in their entirety. Everything in my head goes into the record. It allows me to document my joint decision-making process completely. It allows me to clearly record my safety netting in the clinical notes and in the messages sent to patients. By using auto text, I ensure that the structure of the consultation is well thought out and that all aspects of the consultation have been done, nothing is missed. And by making my life easier, I'm less tired. And that's, if you like, a hidden benefit. And all of
Well,
these things add up for safety for patients and safety for doctors.
well, listen, Barry, thank you very much. In the short 10 minutes we've had, those insights have been really, really helpful. And I know the audience will have been really interested to hear those reflections. Um, any questions, please type them in the Q&A section and I'll get round to asking some of those to Barry at the end. So you've heard some of the great benefits of speech recognition. Well, there's nothing like seeing it in action. So let me hand over to Simon Howard from Crescendo for a demo. Over to you, Simon.
Lovely. Thanks, Simon. And thanks very much to Barry for all those insights into using Dragon on an entirely practical day-to-day basis. It was fascinating. It actually reminded me of one of my favorite headline quotes about Dragon technology a few years back, where a magazine actually used their headline, a little piece of Star Trek just fell to Earth. So thanks for that little reminder. Okay, fine. Time to do a demonstration. So let me firstly just share my screen. And Simon, if you could tell me that you can see that, that would be wonderful.
We can. Yep, all good. All looking good, Simon.
Excellent. Okay. Just bear with me 1 second. I just need to move this toolbar if I can, because I can't see my Dragon toolbar. There it is. Let me just move that down a wee bit.
Just while Simon's doing that, any questions, pop them in the Q&A, please. Thank you.
Okay, so just before I get started, just very quickly, this is the very simple Dragon Medical One interface. You have a little toolbar which will float. You just simply hit the red button to switch the mic on, and we're off live. And there's a few extras and options on the right-hand side. Other than that, you're good to go. So I'm going to give you a quick demonstration. I'm going to take you through a couple of EPRs that you'll no doubt be familiar with, and also show you a more generic demonstration to show some of those auto text features and command features that Barry was referring to. So let's pop the mic on and make a start. Find patient. Anthony Cartwright. Search. Okay. Consultations. New consultation. Okay. Problem. Rheumatic fever. Code list. Choose A. Okay. New line. Mr. Cartwright, a 43-year-old patient, has been suffering from malaise and joint pains for the last week, full stop. Go to history. Mr. Cartwright has suffered from rheumatic fever in the past, full stop, new line. The patient also has a history of depression and has been diagnosed with paranoid schizophrenia, full stop. Go to family history. There is a history of obesity and heart problems on the male side of the family, full stop. Go to examination. Blood pressure, code list, choose A, 155, next, 90, confirm, new line. Splinter hemorrhages of his nail beds and red cells on urine microscopy, full stop, new line. Blood cultures confirm Streptococcus viridans infection, full stop, new line. Aortic, systolic and diastolic murmurs were heard, full stop. Go to comment, bacterial endocarditis, code list, choose B, new line. Concerns over patient's weight, shortness of breath and persistent sweating, full stop, new line. I am requesting an examination and standard tests for type 2 diabetes, full stop. Go to document, create letter. Start document. Dear Anne, new line. Mr. Cartwright, who, as you know, suffers from clinical depression and paranoid schizophrenia, has been unwell recently with rheumatic aortic stenosis and insufficiency, full stop, new line. I am concerned that this may impact negatively on his mental health. So I would like you to see him again in order to review his current medication of oral risperidone, 2 milligram OD, full stop, new line, insert medication history, new line. Please advise if you feel he would benefit from a change or, indeed, an increase in his current regime, full stop, new line. Kind regards, new line, sign my letter. Close document. Close EMIS. Open my EPR. Patient Martin Rains. Start report. This 49-year-old patient presented with a 5-day history of fever, a new continuous cough, sore throat, shortness of breath, muscle pain and fatigue, full stop. These symptoms were moderate to severe, full stop. Insert before patient, male, select 5, 7. Go to end, new paragraph. Insert COVID information. Suspected. Next field. COPD, hypertension and kidney disease, full stop. Next field. Normal. Next field. No. Next field. No. Objective field. New paragraph. Insert COVID examination. Looks well, well nourished, no anemia, no cyanosis, no jaundice, full stop. Next field. Pulse 60, full stop. BP 140/80, full stop. Regular rhythm 16, full stop. Oxygen saturation greater than sign 95%, full stop. Next field, normal. Next field, unremarkable. Next field, Regular rate and rhythm, comma, no murmurs, comma, peripheral vascular system normal, full stop. Next field. Chest expansion normal, comma, chest percussion normal, full stop. Clear to auscultation bilaterally, full stop. Next field. Soft, comma, non-distended, comma, no masses, comma, no hepatosplenomegaly, full stop. Assessment field. Given the range of symptoms that are evident, I'm recommending that the patient is given a standard isolation plan, comma, subject to review at the end of that period, full stop. Plan field. Insert isolation plan. Create document. Select routine. Lifestyle. Go to end. Sign my letter. Close document. Sign report. Close EPR. Open patient. Brown. Search. Select. Home screen. Complete risk assessment. The patient is suffering from extrapyramidal side effects as a consequence of his current medication, comma, oral risperidone 2 mg OD, full stop. New line. He stopped taking the medication after 2 weeks because of this, full stop. New line. Some of the side effects include akathisia, comma, tardive dyskinesia, and dystonia, full stop. New line. The patient has also said that he feels very drowsy and is suffering from blurred vision, full stop. Outcome of risk assessment. We have discontinued the patient's current medication and replaced it with a therapeutic trial of aripiprazole 5 mg OD, which should eliminate the possibility of the extrapyramidal side effects, full stop. New line. The patient has indicated that he would be willing to trial this medication, full stop. New line. We will review the patient's progress in 1 month, full stop. New line. The current risk assessment to self and others is low, full stop. Finish assessment. New task. Dear Jody, comma, new paragraph. I have just sent a draft medication letter to you for my patient, comma, John Brown, full stop. New paragraph. Could you please urgently review, comma, make any grammatical edits if necessary, comma, and send back to me for sign off this afternoon, full stop. New paragraph. Many thanks indeed, comma, Andy.
Simon,
Click
that's
cancel.
fantastic. I'm just conscious of time a little bit.
That's fine. I was right at the end. So
yeah, no, I think what you've done brilliantly is shown the accuracy of speech, the speed at which it can be done, and we also had a question about integration as well, how it integrates with the EPRs and the ease of navigation.
Sure.
So really great stuff.
No, that's great.
Very much
If I could
for that.
just interrupt 1 second on that very subject. You will have noticed there was a little bit of lag when it was bringing up the letter in EMIS, and just to explain that, you know, that is not something that would ordinarily would happen when you're working in your own practice or surgery. It's just simply that for these demonstration purposes, I actually have to navigate through 2 networks to get to EMIS and Dragon. So just to let you know that.
Well, thank you, Simon. It's the thrills and spills of doing things live, isn't it?
Absolutely.
That we all face. Listen, I've got some time just for 1 or 2 very short questions for quick answers. We're not going to be able to answer everything. There's certain questions about licensing, that sort of thing. We'll take all those with the people that ask those offline and make sure that you get answers. One question for you, Barry, which I thought was really interesting. One user came back and said, well, I've been using Dragon for a year or so, but it's sort of flattened off, really. I think that the inference, it's got to a peak. What would your advice be to that individual for re-energizing the use of Dragon?
So Paul at Crescendo can hold a session with you to show you all the features. I mean, what Simon just showed us was Star Trek. If that's not Star Trek, well, what is? And Paul can do a 1 hour session with you to revitalize you. Another really important thing is you've got to use the proper microphones. I don't know if you're using the proper microphones. They've got to be USB connected because the quality of the input is important. So I use good microphones everywhere. I've got 4 different mics. And I think to revitalize you is just to get Paul to hold a session with you to make sure that you're using the latest version, that you're using everything properly, and that you're exploring it. Because everything that I've said is not just stuff I do, but I believe that actually even more can be done. And it's still a journey that I'm on.
Yeah, and I think it's always the thing with software, isn't it? You know, we only do 10 or 15%, but there is so much more, and it's all about how it fits into the workflow. So that's really helpful. And there was, I'll take this question just in the interest of time, but there was a question about the vocabulary and a lot of proper names and ethnic names, for example. How do you deal with that to stop repetition at putting those in? Well, from a practice point of view, it's worth getting a list of what all those are, and then they can be pushed centrally to all the users. That's one of the huge benefits of the cloud. So listen, we've come to the top of the hour. We could have had another half hour, 1 of talking with Barry, 2 really getting Simon to go deep into some of the tips and tricks of some of the features. I like your suggestion, Barry, of following up with the Crescendo team afterwards. Please do. I know they'd really welcome that. But suffice it for me to thank Dr. Barry Sullman and Simon Howard, and of course you, the audience, for joining. This has been recorded. It will be available. And Crescendo are also offering 30 free 30-day licenses for you to have a go with Dragon Medical One if you haven't, and we'll be sharing that information with you. So suffice to say, thanks very much for giving up your lunchtime, and have a good remaining day. Cheers. Bye-bye for now.
Thanks very much.